Good afternoon, everybody. Welcome to this afternoon's call. My name is Jesse Crosscall. I'm with Families USA, and we're really excited to be here with all of you to talk about a really critical moment in our nation's healthcare that we're facing right now. Families USA is sponsoring this call with some of our very close national partners. So I want to just give a shout out to the team effort that went into bringing together this call today. What we're going to do today is give you an update on what is happening on the Hill in Washington, D.C., so you are aware of where we stand in this fight to protect healthcare. But then we also want to highlight some really tremendous work that is happening across the country to collect the stories of people who will be impacted by healthcare cuts and lift up effective messages and tactics that you can use in your own work to protect healthcare. Just a couple of logistical notes before we get started. First of all, this call is closed to the press, so if you're a member of the media, please jump off and just contact our press office separately. And then also, we do have time reserved at the end to answer Q&A, but nevertheless, we do have a chat button that you can see at the bottom of your screen. You can put your questions in there. We might answer some along the way, and then we might just reserve some others to the end of this call. And then finally, we're very excited that Representative Rob Menendez will be joining us a little bit later. Representative Menendez has been a real champion for healthcare, and especially in the Energy and Commerce Committee last week. So when he's able to join this call, we're going to make space for him. But that's going to be in a little while. So first of all, I just want to introduce Families USA's Executive Director, Anthony Wright, who will give us an update on where things stand on the Hill and what we can potentially anticipate coming toward us over the course of the next few days. Anthony, handed it to you.
Yeah, thank you, Jesse, and thank you everybody for joining us. Thank you for the amazing amount of work that you have all done over the last weeks and months since, frankly, November to fight for the healthcare system on which we all rely, and especially for healthcare for low and moderate income folks that rely on Medicaid and the ACA marketplaces. It's been incredible to watch it and to watch all the work around the country, and we're really pleased to hold this call to just provide you a late breaking updates on what's going on. We talked a couple of weeks ago about 3 weeks to save Medicaid. Now we're into 3 days to save Medicaid because this is a critical inflection point in these next couple of days. It won't be the Whatever happens this week is not going to be the end of the story, but it's a critical moment when the House will either decide to go forward with these cuts, over $700 billion of cuts that impact our care, that impact our coverage, that impact our costs, and impact our communities. And I'm going to get into that in a second. But but that's going to happen this week. And so any action to take it. And I've always said that as much as some of the folks on this call are doing incredible work in DC. This is going to be won or lost out in the states and districts of these members of Congress. And so we wanted to make sure that we had a call that was specifically designed for folks who are working on this on the front lines, in red states and blue, in swing districts or not, to know what is going on here in DC. But the report from the DC is that literally last night I was at the House Budget Committee when they passed they literally call it the One Big Beautiful Bill Act, just because that's how the president called it. And it is the bill that would give tax breaks to billionaires and fund it in part by cutting food assistance and in particularly healthcare and in particular Medicaid. The biggest cut to Medicaid in history, over $700 billion. And frankly, we don't actually fully know the extent of it because they passed that without a CBO score, without we've had preliminary CBO scores and that give us an overall sense, but the CBO is still working. The Nonpartisan Congressional Budget Office is still working to piece these all together and to figure out interlocking effects between these. So we actually think that the numbers I'm about to tell you are actually more. In terms of this bill, again, coverage, costs, and care. In terms of coverage, if this bill goes to effect, that we expect that at least 13.7 million people will lose their coverage, over 8 million because of the Medicaid cuts, another 5 million because of changes or lack of changes with regard to the Affordable Care Act. And the main way that we lose coverage is through bureaucratic barriers to get on coverage and to stay on coverage, whether it's requiring folks in Medicaid to have to not just reapply, not every year, but twice a year with regard to work requirements in the ACA to have additional paperwork to even get the tax credits that people face. It's burying people in paperwork for the purpose of having them fall off of coverage. In terms of costs, there's also additional costs in this bill, co-payments for folks on Medicaid, additional cost sharing and premiums for folks on the ACA marketplaces that just make coverage go up, especially after an election that we just had in affordability. Why the hell are we passing a bill that actually increases costs explicitly on low-income people in order to fund tax breaks for the wealthiest? And then third, all of these cuts, both the cuts of just lowering the number of paying patients who are insured, increasing the number of uninsured and uncompensated care, but also direct cuts to states and to providers means that then the healthcare system that we all rely on will have an impact. The quote from a House Republican letter of earlier just this year: cuts to Medicaid also threaten the viability of hospitals, nursing homes, and safety net providers nationwide. Many hospitals, particularly in rural and underserved areas, rely heavily on Medicaid funding, with some receiving over half of their revenue from the program alone. Providers in these areas are especially at risk of closure, with many unable to recover. And when hospitals close, it affects all constituents, regardless of healthcare coverage. That was 12 Republican members just a few months ago talking about what they feared with massive Medicaid cuts. We need to remind those members again. And then I'll just say a word about finally about specific communities. This bill is also has very specific cuts targeted at specific communities, whether it's um, uh, plan Planned Parenthood and women who need those reproductive and preventative health services, whether it's LGBTQ and trans folks needing gender affirming care, whether it's uh, the immigrants and or other populations. There are specific cuts there, but those cuts tend to uh, attack those communities, but also have broader impacts on the healthcare system, impacting many more. And we should make sure that we call them out as well. So this is a bill with a lot of bad things. And then last night, inside deals that were not part of the deal, they made a bad bill worse. They made a bad bill worse by basically saying we want to actually, with those work requirements, we're going to actually do it. We're going to kick more Americans off quicker by accelerating those bureaucratic barriers to be 2 years earlier, when states were already going to be hard pressed to set up these new costly bureaucracies in order to pursue this forward. So that's a little bit of what's in this bill. Again, uh, that really impacts the healthcare system we all rely on, and they're trying to rush it through a process where it was just introduced a week ago, Sunday in the dead of night. They started it on Energy and Commerce Committee, with a debate that started at 1 a.m. on last Wednesday. They passed in Budget Committee last night at 10 p.m. And then now they're planning to put it up for the Rules Committee literally this Wednesday at 1 a.m. again, all under the cover of night. It's almost like they're not proud of what they're producing. It's almost like they know that if people actually knew what was in this bill, and that's what our strategy is. I'm going to turn it to my colleague Jen Taylor in a second to talk about what that looks like. But that's what they're trying to do. They're trying to rush this through so that um, that people don't really pay attention. And that's what the work of that we need to do in the next week is to be loud, to be active, to have the surround sound from every corner of this country that indicates that this is, again, a big, consequential, massive change to our healthcare system that will impact everybody. And we need action in DC, but we need action across the country to indicate that. So, Jen, talk a little bit about what that schedule looks like going forward.
Happy to, and thank you, Anthony, and to everyone for joining today and all of the incredible partners that we have been in the trenches with so far and are proud to keep working with. If we've got to do this, I'm glad we at least get to do it together. And this is going to be a tough week, as Anthony said. So, very quickly, we already said as of last night, the budget committee has now, on their second try, succeeded in getting it out of that committee. In order to do that, they had to make a lot of, as we said, backroom deals and promises with hardliner Republicans who want to see more cuts. Those I know there'll be some questions today. Those cuts, those policy changes, you will not see yet reflected in any language because the budget committee doesn't actually change the language of the bill itself. They're sending it over to the rules committee, which, as Anthony said, will be meeting at the very fine and normal hour of 1 a.m. on Wednesday, early Wednesday morning, where then you will, for the first time, see something in the form of a manager's amendment. That, you don't have to get too wonky on the procedure here. Just know that will be sort of the replacement for whatever this underlying bill has been. You will see these backroom deals and these policy changes finally reflected. And that you may not see until basically the opening statements at the Rules Committee at 1 a.m. So there's a very strong chance we won't see any language until then. Perhaps we'll have some leaks. We're certainly seeing members going out and talking to press about what they are trying to secure in terms of even further cuts, talk of potentially dipping back into FMAP cuts and per capita caps on expansion populations and things that were floated but not included in the versions of the bill we've seen to date. So it's, as Anthony said, a bad bill that can only get worse in this House process. We will see after rules meets, they will put out a rule that will get voted on first on the floor. That could be as soon as Wednesday, later in the day, theoretically during a daytime hour, though there's no promises these days. And then that could bring a bill to the floor. There are some members pushing to bring the whole bill to the floor on Wednesday. They want to get this done and get out of town. More likely, we're looking at a Thursday, possibly even Friday vote, but we should be ready. That once they get this bill out of the Rules Committee, they are going to try quickly to move it off the floor and get out of town before they have to, where they can go on to the Memorial Day recess and not have to face their constituents and the accountability that should come with a vote like this. So, as you're going to hear today and from our partners, our job is to slow down at every possible step this process, to remind members who signed on to the letters Anthony was talking about. If you're on the phone from Texas and you've got Gonzalez and De La Cruz, or you're on the phone from California where Mr. Valadeo, Rep. Kim, Arizona, we've got Siscomani, we've got members that not only signed letters, but spearheaded letters with their colleagues saying they were not going to cut benefits. And now is their time to prove it. Here is this moment. So maybe they didn't sit on committees to cast a no vote along the way, but everybody has a vote on the House floor and everybody has the opportunity to weigh in with the speaker right now about whether or not they can support a package that is this devastating to our healthcare system. And it's all of our job to make sure that every member who previously said they had concerns is loud and taking them back to the speaker, that we're setting up for states where maybe you don't feel like you have a moderate, but you've got Senator Moreno in Ohio coming their way soon, who they've said they've got concerns. You've got a Josh Hawley in Missouri who's got concerns. This is not over yet. There is a role for every person on this phone to play. Certainly this week, hitting all your House members and also laying the groundwork with all your senators that this kind of bill is not acceptable to their constituents. So, and even for you in blue states, we'll talk about things that you can be doing when you feel like, how do I get in this fight? We've got something for everyone. So just thank you for tuning in, staying present through a very painful and rushed process. And, we'll stick with you every step of the way, getting all the information we can. You stick with us, making sure you're talking to these guys on the ground. And hopefully by the end of this week, we'll be able to hold up some measure of success, which would be at the very least making sure that they're not going out on a Memorial Day recess having cut healthcare for millions and millions of people. I'll kick it back over to the team and thank you again for all you do. Happy to answer questions later.
Yeah, and I'll throw it to my colleague Elena in a second, but I would just say there are resources both on the Families USA Defending Medicaid website page, but also of our colleagues. On our page are things like a sheet of the quotes, 20 pages of quotes from members and what they said about defending Medicaid, quick analyses, both a 2-3 pager and a 37 pager of analysis of what is in the bill right now, section by section. fact sheets by individual district and otherwise. And you also have the community here of over 500 folks on this call right now that are doing this work across the country. And again, the idea here is that we are trying to, in a crowded media environment, we're trying to punch through and make sure that people notice this vote's happening, even when they're doing it at very odd hours. We're trying to, and we want both actions leading up to that vote and also after that vote to hold folks accountable so that this is actually one of the things they remember. Not a lot of things in Congress get noticed, but this one should be because of how consequential it is. One of the ways we're doing it is to be there. I was there for Energy and Commerce Committee overnight and on Budget Committee last night, but somebody who was in front of the Capitol for 24 hours was Elena Hung from Little Lobbyists, who was just spotlighting the stories of so many, especially those in the disability community. And so I wanted to throw it to Elena Hung and all the great work she's done at Little Lobbyists. Elena?
Thank you. Thank you, Anthony. Thank you, Jen. Hello, I am Elena Hung, she, her pronouns. I'm the executive director and co-founder of Little Lobbyists, a family-led group advocating for kids with complex medical needs and disabilities. I've been asked to talk about Little Lobbyists and share some effective tactics and messaging. There's a lot to say, so I'm just going to dive right in. This is the most succinct version of my origin story. I'm a mom to an amazing disabled 10-year-old daughter who was born with a number of serious medical conditions. Diomara is the joy of my life, and she's the reason that I am here talking about Medicaid. In 2017, the new administration came after our healthcare with their efforts to repeal the Affordable Care Act. At that time, I was at home, I was watching the news, and I wasn't hearing stories like mine being told. I wasn't hearing stories about disabled children with complex medical needs who rely on Medicaid. So I showed up. I showed up with my daughter at my side to tell that story. And I asked my friends who also had medically complex kids, who also relied on Medicaid, to also show up and also tell their stories. And we asked families like ours across the country to do the same. And then Little Lobbyist was born. And then John McCain made history with his thumbs down vote. It was a huge, huge, huge team effort. And I'm immensely proud of the work that Little Lobbyists did and the role we played in helping put a face on healthcare, and specifically a face on Medicaid. So look, we all know storytelling works, and I believe Colin's going to say a little bit more about this in a bit. I'm here to talk about the how. How do we do this? What are the effective tactics? Because there's a difference between messaging and effective messaging, and we want effective messaging. So I'm going to share 3 tactics that worked for Little Lobbyists and 3 effective messaging points that I want you to use in this fight. So tactic number 1, we center those directly impacted. We are effective when we build relationships with those telling their stories. There's no shortcut to this. So at Little Lobbyists, we provide our families with media literacy. We give them a chance to work with professional writers and editors so they can better tell their story in their own words. This doesn't make their story less authentic. I think it makes it more authentic and more effective. We provide our families with trauma-informed support. This is so important because when we're asking people to share their story, what we're really asking is for them to publicly share their trauma over and over, and we need to respect and honor that. Because when we take care of the people telling the stories, we tell better stories. So tactic number 2, we partner with the disability community. When storytelling centers the most vulnerable amongst us, everyone wins. That is, in my case, when we fight for medically complex children, all children benefit. But when we fight for all children, and that's air quotes, all children, what happens 9 times out of 10 is that medically complex disabled children get left behind. So the same thing is true with disability. When we fight for disabled people, everyone benefits. And when we don't, disabled people get left behind. We won the healthcare fight in 2017 in great part because of the partnership with the disability community. Tactic number 3, take control of the narrative. Medicaid is incredibly popular, and cuts to Medicaid is incredibly unpopular. Polling shows that only 8% of voters think that Medicaid funding should be cut. 8%. So I'll be blunt. We need to do a better job controlling the narrative. Do not get sucked in. This is not about waste and abuse. This is not about undocumented immigrants. This is not about transgender people. Do not let them distract us. Do not let them pit us against one another. This is about not letting them steal Medicaid from Medicaid to pay for tax cuts for billionaires. We need to make that super clear. Because again, there's a difference between messaging and effective messaging. So here are 3 points that have been poll tested and found to be effective. And this is what I want you all to focus on. Number 1, home care. Home care. Medicaid is the nation's largest payer for home and community-based services. That's HCBS. It's also known as home care, which allowed disabled people, including aging adults, to live independently and receive care services in their own homes and communities. You know, for me, it wasn't that long ago that a child like mine was automatically institutionalized for being disabled. Medically complex children like her did not get to come home from the hospital. They did not get to grow up with their siblings. They did not get to go to school with their friends. And Medicaid changed that. Medicaid makes it possible for disabled kids and adults to live at home and be in their community. So let's put a face on Medicaid. Remind people that the home care that they or their loved one may one day need is likely going to be Medicaid. Take control of the narrative. Home care provided by Medicaid makes it possible for us to survive and thrive. Messaging point number 2, please, 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 do not call it work requirements. No, no, no. In theory, work requirements may sound reasonable if you're concerned about how taxpayer dollars are spent. But in practice, they will only make it harder for people to access healthcare. And every time we say work requirement, we are helping them win. So instead, say job loss penalty, job loss penalty. Because the reality is, if you're required to have a job to receive Medicaid, and if you lose that job, then you will also lose Medicaid coverage. That's why we just call it what it is, job loss penalty. So say it with me, job loss penalty. Okay. When you lose your job, you shouldn't also lose your health care. So that's what's happening. Control the narrative. And number 3, these cuts are going to harm a lot of people. Keep talking about the widespread impact. 72 million Americans across the country rely on Medicaid. That's 1 in 5 of us. So keep reminding people of what is at stake. The CBO estimates that at least 13.7 million Americans will lose their health insurance because of this bill, just like Anthony said earlier. So talk about the harmful effects of these cuts on seniors, talk about the harmful effects of these cuts on disabled people, because this is not just bad policy, this is a national crisis in the making. So 1, home care, 2, job loss penalty, and 3, widespread impact. Again, all of this messaging has been tested to be effective and is only effective if we actually use it. And I'm going to close with this. This is a winnable fight. I know we can do this. And I know because we did it in 2017. We can own this narrative. We can protect Medicaid. We can do this. So I'm fired up. Thank you for your time today, everyone. Thank you, Families USA, for inviting me. I hope this has been useful. It has been an honor to be in community with you. And I'm going to pass this on to Colin now. Colin?
Thank you, Elena. And as someone who's been in the healthcare wars for so many years, I just find your activism inspiring, and it has kept you and your daughter and so many of those that you work with just give me the energy that I need to keep going when I'm finding myself a little weary when we get a 1 a.m. markup going on, or a new bill is dropping at 11 p.m. at night. So thank you, Elena. I'm Colin Seeberger, Senior Advisor for Communications at the Center for American Progress. At CAP, we do policy analysis and research and advocacy on the nation's most pressing policy debates. So healthcare, obviously, front and center for our work right now. As Elena said, 1 in 5 Americans is currently enrolled in Medicaid, and we know that healthcare is among the most kind of personal things that people have to deal with, and they think about on a day-to-day basis, and they need to thrive. And so one of the key ways that we are engaging in this battle is uplifting the voices of the people who would be most impacted. So we have a storytellers program at CAP that's run by my colleague Sage Warner, who I'm filling in for after she just came down with a bout of something ugly this afternoon. So please do feel free to reach out to either myself or Sage. But Sage runs our Stories program, and our Stories program is really focused on identifying those individuals around the country who would be harmed most by the legislative proposals that we're seeing on the table. People who need long-term care, and may have disabilities, seniors, children, those with low incomes. And our work is really focused both around helping provide supports for folks who want to be involved, want to engage, want to share their stories and talk about how they could be harmed by these plans. So I'll just drop in the chat a link to a storyteller that we worked with last week around some of the congressional hearings that you may have heard about going on. This is spotlighting Taylor, who's a mom in Warren, Michigan, who has a 6-year-old son with special needs who they're really worried about if states like Michigan are limited in being able to finance their state's Medicaid program, how many of the services that folks rely on most for critical care, like home and community-based care, like Elena was mentioning, but also prescription drugs, a number of different services are not actually federally mandated benefits for Medicaid recipients. And so we know under this proposal, not only do nearly 14 million Americans stand to lose their health care, but we also know that even folks who aren't kicked off their plans may see the benefits that they need ripped away at no fault of their own, as states are being forced to grapple with some of the funding cuts. And so we are really trying to put a human face on this fight. We know that the data is really important, the research is really important, but what moves hearts and minds are people's stories. So we're happy to work with, if you're working with folks in district, and they're interested in writing an op-ed for a local newspaper, reaching out to their local TV station or paper, or even connecting with their member of Congress's office. Happy to reach out to us. We're more than willing to work with folks in your networks, and make sure that their voices are present in this ongoing debate. I would also just say we think about these things. I mentioned a few different kind of tactics. We really think about these things at CAP as kind of a ladder of engagement, right? For some folks, maybe they don't feel comfortable putting their name on an op-ed. Maybe they don't feel comfortable doing an interview with a member of the press. That's fine. It can be just as impactful to, talk about the importance of Medicaid to you on TikTok or Instagram or another social media platform. It may be just as impactful to capture your story in written form and make sure that your member of Congress is able to share that in a congressional hearing. And so we are, actively looking for more folks. We have hundreds of folks who are going to be impacted by this ongoing policy debate, but happy to work with any of you or folks in your network who could be most at harm under this plan, and figure out how we can plug you into some of the various different tactics and actions that we know many of us are working on every single day. So with that, I'll pause and send it over to Teresa, Anthony, Jesse, Jen. Thank you, everybody at Families. It's always great to work with you guys every day. So thank you.
Thank you, Colin. My name's Teresa, or Teresa. I'll answer to either. I'm here in the southern part of Colorado. There is a hell of a hailstorm rolling through here with lots of thunder and lightning. So I hope you can hear me, and I hope my internet holds up. Rural internet. I am in Colorado's Congressional District 3, and we've been doing a tremendous amount of work on the ground to push our representative, Jeff Hurd, on these issues. One of the reasons why Jeff Hurd is a Tier 1 target in this battle is his role in Congress, but also because his father opened the very first federally qualified health center in their home community of Grand Junction, Colorado. And so this is someone who understands and who has a history of understanding the role of Medicaid and how important Medicaid is, not just to folks who are the direct recipients of Medicaid, but to whole communities who depend on good health of their neighbors and depend on those Medicaid dollars for employment. This is a district, curiously enough, that Lauren Boebert first got elected to Congress in this district. And it was in 2022 that she narrowly eked out a win by about 500 votes, which is unheard of in a congressional race, that forced her to move to an even redder district in Colorado to run. And so, we also believe that our congressional representative is more of a moderate. That is our hope. That is some of the things that we've heard him say. It has yet to be proven in some of his actions. But we've really have this is a community with a strong history of resistance, strong Chicano movement and American Indian movement here in this part of the country where folks are tied to the land and to the people and have been for many, many, many generations. This is not our community's first rodeo. And so we have really taken to the streets in terms of canvassing. We ran a canvass yesterday and have been canvassing our neighbors to get them to make phone calls and send emails and postcards. We have done public actions and rallies. We've had about probably 15 or 16 visits to local offices where small groups of folks are going to visit local offices to share their stories and to apply pressure in those ways. And, we've really taken advantage of the fact that that Congressman Hurd was one of the very first 12 to kind of break ranks and speak out about wanting to defend Medicaid. So we've done things like celebrate that small win in our community with, and in others in his district, with an ice cream social where folks can come and celebrate that that's what he's talking about and sign a postcard and send him their story so that he can be prompted to actually follow that up with action. It has really been a whirlwind of activity here in Congressional District 3. Some of the other things that we're doing is we've been in contact with a number of town councils and county commissions. This is one of the geographically largest congressional districts in the country. And so, it is a 6 to 7 hour drive from one end to the other. And so really trying to pinpoint significant counties across the district and get those town councils and get those county commissions to sign and pass resolutions in support of Medicaid defense has been one of our primary strategies. And while we have we've gotten a lot of pushback from those town councils and county commissions that they don't want to put him publicly on notice in that way. We know that they are making phone calls behind the scenes. We know that they are pressuring him. There was a physician at one of the rural hospitals who was able to get an op-ed published in the New York Times about the impact that this will have on local hospitals, which really spurred to action a number of our hospital administrators to then fly to DC to meet with Representative Hurd. As I said, we've been working a lot on canvassing and really have found a lot of partnership in our labor brothers and sisters. Those are some of the folks that have been helpful to us in reaching out and really pushing our community to be more vocal and to take a bigger stand and to communicate more regularly with their congressional office. It's been really interesting to see the broad base of stories that are coming from folks. Certainly one of the barriers that we've had to some of the on the ground organizing is that we have to acknowledge first that this system that we're organizing, Medicaid, isn't a perfect system and doesn't always meet the needs of folks who are recipients of it. And so acknowledging that with folks has been a really crucial step with us. Yes, we know that Medicaid may not be meeting all of your needs. It may not be all that you need it to be, but we're defending what it is so that we can improve it in the future. And folks have really responded to that. One of the other barriers that we've experienced is there still is a lot of particularly among more middle class folks, a lot of shame in having been on Medicaid. And so, instead of asking folks to share their stories on a video or to share them with media, those postcards have been really a wealth of and really a source of being able to pull those stories forward and be able to share those. We're sending a group of folks on Wednesday to Washington, D.C. to participate in some direct actions, perhaps some civil disobedience. I only say that because there's no media on this call. And they're really planning on sharing about 40 or 50 stories from counties across this district in his office on that day. And so we know that it is really all hands on deck. Folks are here in Pueblo, in this county, are really engaged in calling regularly. But we've got about 7 other counties in this district where there are groups of folks that are pushing their town councils and county commissions and are also calling and contacting his office daily and sending small groups of folks with their own stories there. And so this has really been an opportunity for our community to come together in some really significant ways. Folks who've been at this and doing this work for generations have really been folks who've pushed for us to find a lot of joy in the work. And have really pushed for lots of community building and not just sort of the transaction of getting folks to make calls and to have their voice known, but we're really building a broader network of folks who are willing to take action in the long haul. And so we're really grateful for all of the support that we've received from so many fantastic national partners, People's Action, Families USA, all sorts of folks, Community Change. They've really supported us well in being able to provide tools in the field for regular everyday folks to pressure their local officials and to ensure that their voices are heard. And so really appreciate this opportunity to speak to you all today. And I'm going to hand it over to Simon.
All right. Thank you, Teresa. Quick programming change that we're going to make. We are very honored now to be joined by Representative Rob Menendez from New Jersey, who has shown himself very quickly to be a true healthcare champion. For anybody who was following along last week in the House Energy and Commerce Committee, Representative Menendez gave voice to a lot of people who will be impacted by these cuts. Representative Menendez, welcome. You have about 500 activists from across the country on the line who are eager and really excited to get out there and make their voices heard this week. So very interested to hear what our task is in the next couple of days. So tell us what we need to do.
Well, first, thanks for having me on, and to all the folks on, thanks for your participation. We need your involvement. We need you all to tell stories like Teresa was talking about, to really humanize Medicaid and what it means for so many families across the country. I think something that Teresa said that I think is so true is when you're engaging with people who may rely on Medicaid or have previously relied on Medicaid, and it's not the program exactly how we need it to be. Right? Like this current version of Medicaid still has a lot of work that we need to do for so many families, especially those with long-term disabilities. And that's what makes the cuts to Medicaid so hard to comprehend, right? Because we know we need to improve healthcare in this country from the time of birth all the way through, right? We need to create healthier outcomes for so many Americans. Taking away Medicaid is moving us in the wrong direction. And so some of the points that I tried to make during our 26-hour markup, right, is it's important that we put this in the context of reconciliation, right? Because Republicans are going to talk about fraud, waste, and abuse, about work requirements, about able-bodied people, right? But if they really believe that there was savings in Medicaid, if they really believe that Medicaid is essential, then they would be reinvesting any dollars that they save from this bill back into Medicaid to make it a better program. But because it's reconciliation, they're taking healthcare away from 13.7 million people to do what? Not to make Medicaid better, but to pay for tax cuts to people who don't need it. Right? These are not tax cuts for people who may be on Medicaid, right? Or Medicare recipients. These are going disproportionately to the wealthiest people in the country. I'm not even talking about the 1%. I'm talking about the 0.01% of people, right? So that is where I think Republicans' argument really comes apart. Because this is not about Medicaid. It's not about the solvency of Medicaid or really for the people that Medicaid was originally for, right? Those are the things that we heard for 26 straight hours. This is about paying for tax cuts, right? And there are Republicans who don't think that this version that we marked up in E&C last week goes far enough. So that is a challenge because Democrats are here to create better healthcare outcomes for all Americans, right? Improving Medicaid, improving Medicare, including early childhood care, right? The things that we know create better health outcomes for all Americans, starting as early as possible, doing as much preventative care as possible, so we can give people that expectation of being covered, having access to healthcare, and making sure that they can live their healthiest lives. Like we know that that's what we want to do, and Republicans are just completely falling short with reconciliation. You know, they talked a lot about, and you're going to hear this if you're doing any meetings with Republicans, about able-bodied people, right? Able-bodied people, and this is getting them back to work so they don't rely on Medicaid. Okay, the problem with that is that we already have the data that shows that most people on Medicaid who can work are already working, right? That's a fact, right? So we highlight how Georgia and Arkansas have these additional work requirements and what that actually did, right? It didn't enhance the program. It just made it less accessible for people who are really hustling every single day, right? These are people who are working, but they're likely also taking care of families, either children or their elders. They're trying to figure out housing because we know that continues to be a challenge for so many Americans. They're trying to do all of these things, and Georgia and Arkansas said, in addition to this, we need you to do more regular reporting to stay on the program that gives you access to healthcare. Right. And what happened in the challenges that we all face on a daily basis trying to juggle all of this, people forgot or failed to file their reporting requirements, right? Or they moved and the letter didn't go to the right place, or they don't check their email because they're working crazy hours to make ends meet for their family. And what happens? They lose access to healthcare, right? So we know that happened in Georgia. We know that happened in Arkansas. We know that these additional reporting requirements that are part of this bill are only going to cause people to lose access to their health care. And it's a double whammy because it's not just Medicaid, but they also won't qualify for the support on the ACA marketplace. So it's a double whammy. That's how you get to the 13.7. And when I asked Republicans, I said, listen, there's no way that all 13.7 million people are these able-bodied people who could go to work but don't want to go to work, because that's the narrative that Republicans keep putting out there, right? So I asked him, I said, you know what happened in Georgia, you know what happened in Arkansas, that people got bumped from Medicaid because of these reporting requirements, this additional red tape. How many people do you think under this bill are going to lose access to health care because of these additional reporting requirements and red tape? What's the number? What's the percentage of the 13.7 million people? And they did not have an answer. One person said under their breath, 0. And this is recorded, so you can, if you're interested, not worth your time, you have other things to do. But I said to them, say it into the microphone. If you think the number is 0, say it into the microphone so all of your constituents, right? And God forbid any of the 13.7 live in that person's district, but say it into the microphone that 0 are going to lose access to healthcare because of these additional reporting requirements. And he wouldn't do it, right? Because they know the truth. Right. And so that's what the story that we have to tell people. We can't allow people to buy into this Republican narrative. It's been false since day one. It will be false every single day that they continue to consider this bill. And we know that this is that no matter what happens with reconciliation, there's a significant portion of the Republican Party that will go along with taking health care away from people to pay for tax cuts. We know there's also a part of the Republican Party that wants deeper and steeper cuts because they don't believe that Medicaid should be a program for people across the country, even though Republican districts disproportionately benefit from Medicaid. So, these are the conversations that we're having. This is the argument that we brought to Republicans over 26 hours. But we need all of you there, and we need all of these Republicans who are considering voting for it, having to look at you all and tell you that this program, the way they're designing it, the cuts that they're going to make aren't going to impact you, because they will. And that's the fight that we're in. I wish we were having a conversation about how do we make healthcare more accessible and affordable, because that's what Democrats want to do. And that's the last thing I'll say is I pointed out that they don't do town halls, right? But when I go back home, no one is saying, whether they're on private insurance, on Medicaid, or on Medicare, that healthcare in this country is too accessible and it's too affordable, right? No one's saying I could do with less, right? People are saying the programs as they're structured, all of it it barely works for me, right? And yet this is the conversation that Republicans want to have. This is the direction that Republicans want to have. And it's just so misguided. And frankly, it's shameful. Like, we should be sitting down, and if they think there's fraud, waste, and abuse, let's go find it and invest it back into the program. Right? Let's make Medicaid better. That's not what we're doing, right? And so don't let Republicans convince themselves or anyone else that this is what they're trying to do, because it's just not true. So I'm here. I'll be here. 26 hours straight was fun. I didn't sleep. There's no real thing as getting caught up on sleep, but it's the fight that it's a fight. It's a fight. And there's no place I'd rather be. It's an honor to fight for people back home and across the country who need people to have their back, and to let them know that we're not going to be quiet. We're not going to treat this as normal, and that we have to stop the harm that this administration, Republicans, are seeking to do, so we can fight for those better tomorrows together. So that's all I got for you. I don't know if there's anything I didn't touch on that you'd like me to, but want to make sure that I'm as helpful as I can be.
That was excellent. Thank you so much, Representative Menendez. And again, thank you for your leadership, and for standing up for so many people around the country and in New Jersey. So we now want to make sure that we give folks on the line some specific actions and tactics that they can take over the coming days. So I'm going to pull in my colleague, Simon Marshall-Shaw, to give you, those of you on the line, some ways that you can weigh in.
Thanks, Jesse, and thank you all so much for being here. So like the representative just said, we need you all to be here in this with us, and thank you for being here and getting all of the folks you work with mobilized. So what we want to share is a few ways for you to take action now with us and with everybody on the call and in your communities. There's 3 things we want you to do. You've seen these before, and we've just revamped them a bit today. So the first is call and email Congress. The second is join us in Days of Action. And the third is use social media strategically and collectively. So to go back to call and email Congress, we have a hotline here with the number on the screen. Please use that number to get in touch with House members in particular. There's also a call-in day. That's the second bullet here. That's being coordinated by the Americans for Tax Fairness and Public Citizen. So I wanted to be sure that you all had that. That call-in day is tomorrow, and there's also a number associated with that. So if you want to set up a phone bank or get people on the line together, it's a great way to do that. And you'll be in community with hundreds of other people who are also participating in that call-in day and organizations across the country. We're putting the links in the chat now for phone banks that the SEIU and People's Action Institute are also coordinating. So that's for anybody, right? We want folks who are in blue states looking for something to do to get engaged. That's a way to get in touch with people all across the country to tell them to call their reps and be engaged in this. Again, we need all of you there. Joining us in Days of Action looks like doing the above, but also sharing out our page, which is a Days of Action page. It has resources and templates for you. It has communications tools. It has social media toolkits. And the main message from that page is hands off Medicaid. That's using hashtag hands off Medicaid. That's using other social media toolkits that we've got on that page. And it's really making clear that Congress is moving too fast to really be able to consider these changes, that it's doing nothing to address corporate greed that we know is driving up costs. And instead, it's ripping healthcare away from millions of people. So please use that hashtag. And that brings me to number 3, which is social media. So we've got hashtag hands off Medicaid. It's been a bit of an evergreen one, but on these days of action and this week, really a week of action as the bill moves forward, we want to be using that hashtag collectively. And in addition, we've got social media toolkits that we're sharing again in the chat. There's one that Families USA has put together with some graphics you can use. There's also another one with tons of different great graphics by the Cost and Coverage Collaborative, especially focused on some particular communities. I believe it's also most of it has been translated into Spanish as well. So please feel free to share that. And then last but not least, we talked about storytelling a little bit earlier today. And I wanted to mention that we do have a healthcare storytellers handle. That's a joint campaign across a number of different organizations that are amplifying the stories of millions of Americans who are at risk of losing their healthcare. So please share stories with that account. Please get in touch with the organizations, including Families USA, that are a part of that effort, and we'll be sure to uplift those on these accounts, and make clear that storytelling needs to be a core part of this campaign and effort. So take these down, look in the chat. We're going to be sharing out resources again and follow up as well. But I'll hand it back over to Jesse, and we'll see if we've got some time for Q&A.
Great. Thank you, Simon. So we've had some tremendous speakers, but we are bumping up against the top of the hour. So we do have a few minutes for some Q&A. Again, there's a button at the bottom of your screen where you can type in, and we will answer as many as we can. One thing I'll just say at the top, because we got a few of these come in. One, Elena was a huge hit at the top of the call. We will be sharing some of the messaging advice that Elena laid out. We're going to have a follow-up email to this where we're going to have that slide with the link that Simon just had up. We'll have Elena's messaging advice and some other things in there. So stay tuned for that either later this afternoon or tomorrow morning. So I am just scrolling through the chat right now, going up basically to the top of this call when they were talking, Anthony and Jen were talking about some changes that were being made specifically around work requirements. Can you just reiterate that, Jen, what you've heard about where they're potentially going with making changes to the work requirement provision of the bill?
And Sophia, our Senior Director of Policy, is on. So Sophia, I'm actually going to let you handle a policy question on what we see on changes around work requirements.
Sure. I mean, I think the big thing is there have been no changes yet to what came out of the House Energy and Commerce Committee. Right now, it's a work requirement at reporting 80 hours of work a month. And as folks have been asking in the chat, like that would be extremely burdensome for the individuals. It'll be on the responsibility of the Medicaid enrollee to demonstrate that they are meeting that requirement, or that they meet an exception, which, as folks know, is extremely burdensome in terms of those paperwork reductions. But what we are hearing right now, as things come out of the Budget Committee and move towards the Rules Committee in the middle of the week, is that the hardliner Republicans are really pushing for speeding up the implementation of that work requirement. Right now, it's set to go into effect in 2029, and we're hearing it could be as early as 2026. We don't have the details of any of that in writing. It's all just rumored and what is being reported on here in the nation's capital. So if we have those details in writing, we'll be sure to send out updates so folks know exactly how the current text is potentially being changed.
Sophia, I'm going to stick with you and with this thread on work requirements. We got a question about just the state burden of implementing these programs and how that should factor into how we talk about the work reporting requirements and, to draw attention to their harm.
It's an incredibly important question. I think, as folks know, the state burden is substantial. We have evidence from the last round of fighting work requirements under the first Trump administration about the state costs, the actual costs in states like Arkansas, and others that it would take to stand up a system, it's very, very expensive. It costs a lot of money, and some might say it's not an efficient use of Medicaid dollars and state dollars to stand up those reporting requirements. So I think there's some questions. How important is it to demonstrate what the cost savings, the cost estimates would be on states for standing up these systems? Super, super important. In any way you cut the proposals coming through, it's all about forcing people off coverage, increasing the cost of care, and shifting the burden of costs of financing a Medicaid program onto states and putting states in a very difficult position about what benefits and services they'll be able to offer and how they're going to generate their share to be able to do that.
All right. Next question is kind of a tactical one. So maybe this is Jen or Simon or Colin. Just some questions about for folks who live in blue states or in a district where their representative is not going to vote for this bill, and we know that. But like, what can folks in those situations do to make their voices heard?
I'll kick off. I would say, I think still raising the alarm bells and making sure that your local and state electeds are on the same page as you is really important. Particularly at the local level, we definitely want to encourage that with state officials, local officials, whether that's mayors, whether that's health and human services leaders, even faith leaders at the state and local level, to be sure that they are also talking to the congressional delegation about what the impacts would be is really important. And then even thinking about regionally, there could be collaboration across regions as well, making sure that if you are in a blue state and that means that your governor is the Democratic governor, have they been speaking out about this? Have they asked the Health and Human Services Department to issue a report about what these impacts would be on the state health system? Things like that. There are some great examples of that too over the last few weeks and months we've seen, but thinking maybe there's a way to work with state leaders in a region to demonstrate the impact. So I think that's one broad way. I would say also tangibly encouraging folks to join the phone banks that we've listed and put in the chat. Those are great ways to get involved and still be calling people who are in other states, but are not necessarily going to be your same community members, but getting community members and friends and neighbors together to make those calls is a great way to stay engaged and involved too. Jen, if you want to add anything else too.
I think that was perfect. I think the one other thing I would say, and I see several of you either asking questions or sharing stories and questions with us, is sharing stories. Members of all stripes are, in particularly members in blue states, are trying to lift up the stories of harm. So if you have somebody, you're sort of in a blue state and you don't know what you can do, I mean, I think the more stories you can lift up and arm your members with, they're using them on the floor, they're using them in social media, they're using them to really try to like get that message far beyond just their district and out into the ether, and to hold their colleagues accountable for what they're doing. So you've seen a lot of that back and forth at the hearings with members doing that. And I think in everything else Simon just said, I would totally underscore, and I would just say keep those stories coming. I know they are difficult to get and need to be taken with care, but they're so impactful right now. So anything you can do there is really, really helpful.
And if I can add just one quick thought on that again, I think even just making sure that you're talking to people who you interact with regularly about the impact that these cuts would have, and that it's happening, it's moving forward. The hearings and markups are being scheduled really at night, right? Like at times where people are not paying attention. It's moving really quickly. That is something that most people are not necessarily aware of, even though we've got hundreds and hundreds of us on this call. That's part of our job, is to make that message really broad and wide and clear. And so I just say I would encourage everybody to continue to get that message out there, and just whether that's talking to the media, if you're trained and able to do that, or if it's just talking to your neighbor about what's moving forward, that still has an impact right now.
That actually, Simon, was a wonderful way to bring this call to a close. Truly, thank you everybody for the work you are doing across the country to shine a light on what could be some horrible impacts on our nation's healthcare system. But we, along with all of you, are going to keep up this fight. We have a big week ahead of us. As has been said, we're going to send around the resources that have been mentioned on this call. So you have messaging guides, you have some policy analysis, you have specific ways you can contact your members of Congress. Thank you, thank you, thank you. We will be in touch. We will keep you updated. as things progress here in DC. And good luck out there. We have big work ahead, and thank you for everything you're doing.